Good morning. The clerk has confirmed that we have quorum, so I'd like to call this special meeting of the Aboriginal Affairs Committee to order. This meeting is being held using the city's WebEx technology, with members and staff calling in or connecting by video conferencing or attending in person at Toronto City Hall. While under normal circumstances, we would not be able to hold a virtual meeting of the Aboriginal Affairs Committee, City Council has amended the simplified procedures for advisory bodies to allow it during the COVID-19 emergency. Once the emergency is over, we will return to holding our meetings in person in accordance with the advice from the City of Toronto's Medical Officer of Health. Because we are meeting remotely, we ask for your patience with any delays and technical issues. Members of the public can observe the meeting on YouTube. There are no registered speakers for this meeting. I would like to request that all staff keep their video turned off unless they need to speak or answer questions. This will make it easier for me and those watching on YouTube to observe members as they participate in the debate on each item during the votes. I'll also ask that all members and staff keep their microphones on mute unless you need to answer a question or speak. If any members do wish to speak on an item, I ask that you wait until staff have presented. I will then ask if any members wish to ask questions of staff or to speak. If you do, please make sure your video is on and raise your hand or unmute your mic and indicate your intention to speak, and I will create a speakers list. When voting on an item or motion, I ask that members make sure that your video is turned on and raise your hand to indicate your vote. To start the meeting in a good way, we will have an invocation by Larry Frost. Larry, could I ask you to start us in a good way?
Well, Creator, we thank you for bringing us together today. We ask you to continue to guide us in a positive way with good collaboration, good partnership. And Creator, we ask you that when we speak around the table in a good way, that we have an action plan that moves forward for everyone. So with that, Creator, I thank you, and Creator, I ask that you shine a beautiful light upon all of us, that we know we're always healthy through this COVID virus that's going around, and we always continue a journey of positive and good health. With that, I say make which. Thank you so much.
Thank you, Larry. Although we're all in different locations and meeting remotely today, the Aboriginal Affairs Advisory Committee acknowledges the land we are meeting on as the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississauga of the Credit. Members, are there any declarations of interest under the Municipal Conflict of Interest Act? If you do have an interest, please unmute your mic. Any conflicts? Okay, seeing none, we will proceed. Members of the committee, as this is a special meeting, the committee may only consider the business on the agenda and no other business. I would also ask members to please email motions on any of the agenda items to the committee secretary. That can be done using the email address ecdc@toronto.ca. Okay, that brings us, formalities aside, we're going to get ready to move to our one item on the agenda and introduce the first speaker. I do just want to say that I'm very grateful as the co-chair of this committee that changes were made to enable standing committees like this to meet. I think it's especially important that we come together as a city, as service providers and organizations to support each other as partners to get Indigenous folk through COVID-19. And I'm very happy that we have our partners at the city today with two presentations to work with our membership to move this stuff forward. And so I would like to introduce the first item. This is item AA 4.1, COVID-19 Recovery and Rebuild. And members, there are two staff presentations on this item. The first presentation is by Mr. Raffi, the Chief Recovery and Rebuild Officer, and he's here to provide a presentation to the committee. So I'd just like to introduce you, Mr. Raffi, and we will move to the first presentation. Miigwech.
Thank you very much, and thank you very much for the opportunity. I'll just wait a second to get the presentation on the screen. You're going to be, yes, thank you very much. It's coming up in a second. Wonderful. Thank you so much. Can we go to the next slide, please? So again, thank you very much. Excuse me, I started in this role in late April, and the efforts that we are going to be undertaking on recovery and rebuild for the city will be guided first and foremost by public health priorities. And the necessary conditions that must be met will be dictated by public health and the medical officer of health. And so I'm joined in this effort by Dr. David Mowat, who is a senior advisor to Dr. Eileen Davila, who is the medical officer of health, as you know. And Dr. Mowat is a public health physician himself and quite renowned in Canada and experienced in all manner of pandemic monitoring and management. So because of the public health nature of this crisis, there's no sort of start or end date, unfortunately. And we can't point to a particular date when various parts of the community or economy will be continued to the next phase. And so much so that the provincial government has the regulatory responsibility under the Emergency Measures Act Emergency Management Act to undertake reopening of various functions, businesses, etc. So as I mentioned, this virus will dictate the timelines. And we are working on various scenarios with public health to try to get ahead of what the province might be thinking in terms of their next stage. And as you know, they announced recently a stage 1 restart. So we're in discussions with them and hope that we get the requisite amount of notice to assist our communities, our populations, and our businesses before they go to their next stage of restart. Excuse me. And we'll be in the recovery and I will say perhaps the rebuild stages until sort of all systems of the city are returned to normal or better. And it's our hope that it would be the new normal would be better. And that's some of the work that we're going to do. We'll be working with all partners and communities to help with both the social, the economic aspects of returning the city to this new normal circumstance. And of course, each community, each organization will have its own unique criteria for success or its own unique criteria for when it returns. And that is also part of the effort that we are putting in through the recovery and rebuild phases. May I go to the next slide, please? Thank you. Pardon me. So there are really 3 phases. One could argue even 4. We are in the response phase, which has been since middle of March. But for our work at the Office of Recovery and Rebuild, we're looking at the sort of restart, reopen phase, and we're working in close partnership with Chief Matt Pegg, who heads up the Emergency Operations Center. Then we'll move into this, which is about the city resuming its services on a gradual basis, and also the city being a model employer in that regard and determining whether it and how it can continue the work from home arrangements for many services that the city undertakes. So the senior management team led by Chris Murray, the city manager, is in the throes of examining that right now. And then in addition, in the restart reopen phase, we have to determine what city services are going to be necessary to assist those businesses and those communities when the province moves to its 2nd and 3rd stages. The next phase, or the next aspect, is the recovery phase. And this will be about plans and partnerships with other levels of government to support the economic and social recovery once the pandemic begins to subside. And that, again, guided by public health data. And last, we'll move into a rebuild and reimagine phase. And this will be about exploring ideas that would perhaps traditionally not be the way the city delivers services. may not be the types of partnerships that the city has had traditionally, but rather what could be reimagined through the opportunities for change and transformation, and what is necessary to rebuild the city, its communities. And again, this will involve other levels of government. This will involve unique partnerships with many different sectors. And so that's the sort of trajectory of the work of the office. Next slide, please. So the objectives for us is to have a very broad engagement approach with stakeholders, with residences, with Indigenous communities, council members, as the office reports to the city manager and through him to the council. It is to look at this from a citywide, and I dare say perhaps even a region-wide approach, which again, guided by public health evidence and best practices. We have been looking at other jurisdictions around the world, not just in Canada. And then also we'll leverage the numerous subject matter experts within the city's staff who have deep operational expertise and use those individuals to help guide our work. We're a very small office of 8 people, but we have the expertise and advice of partners, of community members, of agencies, and of course the subject matter experts, in the city divisions. Next slide, please. Go to the next slide, please. Thank you. Excuse me. So, pretty straightforward schematic. We have established a research agenda. As I mentioned, we've been doing a fair bit of interjurisdictional research. We have put forward some of our objectives, goals, and outcomes. We are just entering our engagement phase, and we're doing this across, and I'll get to that in a subsequent slide, across 7 various themes. And then based on that feedback and input, we'll look at actionable and implementable options and recommendations. So that'll be done through the analysis phase of this work. And then we will have an opportunity to then bring a report through the city manager to council for their consideration on the recovery and rebuild. And so that's the sort of trajectory and path that we're on. And can I go to the next slide, please? Thank you. Excuse me. So as I mentioned, this is about bringing recommendations to the senior leadership team, sorry for the acronym, SLT, and of course, ultimately to City Council. We are very much interested in actionable and implementable recommendations for the city's agencies, corporations, and divisions to help communities and partners and businesses in the process of recovery and rebuild. We know that this pandemic has had a very dramatic effect on all manner of organizations and communities. So through broad consultation, we will use existing tables. We have the opportunity and advantage of being able to come to this committee and to hear your views and to talk to you about how best to engage you. And we will do the same with other established organizations, whether they are a committee of council or not, in order to, one, not duplicate outreach, and also try not to sort of fatigue participants who are likely being asked for their input and feedback through many different means and measures. We will also use the existing work that the Mayor's Task Force has undertaken through the co-chair approach on several tables, with several tables by councillors, and we're analyzing that information and talking with those councillors as well. And we'll look at what services the city should examine and continue to sort of reimagine as we look into the rebuild phase. We'll look at what sort of investments are necessary, what sort of additional partnerships are necessary. All this to, as I mentioned earlier, to come out of this, the throes of this pandemic and sometime in a better format and form than pre-COVID. Next slide, please. As I mentioned, we have 7 themes, and we've identified through the assistance of the city manager and the senior leadership team, 4 leads for these 7 themes. Excuse me. So, of course, as I mentioned, the city's divisions and agencies and their preparedness is a distinct theme because I think for fairly obvious reasons. The next would be resilience and climate change, and this cuts through all the themes as you would imagine. Third is vulnerable populations. Fourth, lack of just another better term, we landed on strategic alliances, partnerships, other ways of engaging with various organizations on an ongoing basis is really what that's about. And then there's a fifth theme, in government and financial renewal. I think you would have heard a fair bit about the city's fiscal situation and financial situation. This is an opportunity to examine institutional and other types of strategies that the city could deploy, that senior levels of government could deploy to assist with increased revenue opportunities, because the city has very few options in that regard, I think, as everybody would know. And the last 2 would be to look at business and culture, those industries and sectors, and get a sense of what their needs are. And you would imagine they would be quite diverse, from independent restaurants, retailers, right through to the largest employers in the city. And then we're still working on the sort of title or brand, if you will, but something that we can work with to help citizens of the city, to help local communities, local businesses, to buy local, dine local, etc., and also to help all citizens in terms of trying to celebrate and come out of the challenges we find ourselves in, with, of course, a respect for the fact that this pandemic has cost us very tragic circumstances in terms of people's lives, and we will be very respectful to that. It is less about a celebration than it is about just a promotion and inspiration for people within the city. And you can see on the right the leaders that we have who are leading these themes. They will and are about to launch and have started to have conversations with various tables, organizations, and get their input on these themes under the category of recover and rebuild. Next slide, please. So in terms of the Aboriginal Affairs Advisory Committee, there are some examples here of engagement, but the point is not to say that this is the only form of engagement. We really want to hear from you as to what will be your engagement, what are your engagement suggestions, and there are methods to provide input beyond just an outreach exercise, whether that's written submissions to our email address, whether that's submissions to the website that we are hoping to launch late this week, and we'll have an engagement guide there with questions. We'll have a survey for the general public as well, or for organizations. And so we're trying to provide as many opportunities as possible for people to provide their input to us. There will be counselor kits available so that counselors can do their own engagement and outreach. Excuse me. And so this, I think, concludes my presentation, and hopefully I can turn it back to the committee to get your sense of how you would want to be best engaged, and any questions that I might be able to answer. And thank you for your attention.
Thank you, Mr. Raffi. Members, are there any questions of staff on this presentation? If you do have questions, please raise your hand and unmute your microphone to let me know. I see Francis. Francis Anderson, would you like to make a comment, please?
I would. And thank you, Mr. Raffi. That's a lot of work you got going there. you were talking about engagement, research, and recommendations. I think it's on page 5 of your slide. The city will undertake research and learn from the Indigenous community. What do you hope to learn? What kind of research are you doing in our community, or you hope to do?
Well, I would say that our focus would be more on engagement and understanding the needs and interests of your communities. And we want to be able to understand that in a informed and intelligent way. I don't think we can, this is not about sort of researching something to learn it, but rather learning it through engagement with either the committee and or the organizations that you represent. We don't have a fixed view on how best to do that. That's why we're here.
Okay, I have a follow-up question on your 4 leads across 7 themes. The background of these four leads that you have they all had Aboriginal awareness training? Have they had their
Well, that's a very good question.
training done?
I don't know that. Let's say that they haven't. We would welcome that opportunity for sure. But it's a good question. I don't know the answer. I apologize.
Because if they're going to start to engage in research and come into the community, they should have a knowledge and respect for the traditions and culture.
Indeed, I agree. We'll talk with Selena about that right after this meeting. Thank you for that suggestion.
Use your resource.
Yes.
Thank you, Francis. Further questions from the committee for Mr. Raffi?
You're getting off easy, Mr. Raffi.
I have a couple points, but generally as chair, I raise my questions and comments last. I just want to give folks another chance. You can raise your hand in the chat box if you do have any questions or comments.
If I may, Mr. Chair, it's Mike Layton here.
Please.
Just on how the consultation will be rolled out. When could we expect that engagement will begin? In particular with the Indigenous community, but more specifically across the corporation and all. Like, we've got people wearing many hats on this committee that work both on the social service side, but also bring an Indigenous perspective over. There's people on economic development, there's people on social services. When could we expect that those roundtables will begin to get pulled together? What's our time frame here? End of May, early June?
We hope to start in June and through the month of June conclude all the engagement where possible. I think, as you know better than I, the ability to get people and organize sometimes can be challenging. And specifically for the Indigenous communities, that's really what we're going to follow up with Selena on to get a better sense of what the most effective method of outreach and engagement will be. So we hope to start early June, which is really next week, and throughout the month of June.
And will there be an opportunity for the Indigenous community, both those on this committee and the broader Indigenous community of Toronto, to comment on sort of all aspects of the recovery plan? What's the starting point of the dialogue? I know we've talked about the research that and stakeholder work that was done by this mayor's task force, as that being kind of the framework that will start the greater community dialogue. Just maybe this hasn't been set up yet about what will this Indigenous consultation be able to comment on? Is it broad, or is it focused on the sort of kind of social service delivery that most of this committee does?
No, I think it can be whatever the members desire. We'd be quite prepared, of course, to have the Aboriginal Affairs Advisory Committee comment on our draft findings as well.
Thank you.
Thank you.
Ruth?
Hello. Hello. My name is Ruth Colza Green. I hear you talking about the engagement with the social service sector, but are we going to be Are you going to be engaging any of the very strong Indigenous academics that are across this city that have a depth of understanding of how to do that Indigenous research, how to pull those communities together and to work within our own communities instead of because I hear you say, you know, we'll do cultural competence training, but it may not be enough to actually engage the community in a holistic way. So maybe it's looking at Indigenous researchers instead of just a few trainings. So just a thought.
Sure, thank you. I mean, this is why we're here, is that I and my colleagues want to learn about the resources that are available and take advantage, candidly, of their expertise and backgrounds.
Thank you, Ruth.
Thank you. The presentation was very helpful.
Any final comments before I throw my 2 cents in, committee members? Okay, I'm not seeing any hands. So, Mr. Raffi, I just, if I could, wanted to ask a question and follow up with a comment. So I do appreciate this presentation, and I appreciate the way in which you've come to the committee with an invitation and loose engagement for us to come together and think about how we do this in a good way. I have some questions about the rebuild and reimagine phase of the plan. And I think about back to when I was working with the city and I had the opportunity to co-create the Indigenous cultural competency training that we use here at the City of Toronto. And a lot of our conversations around COVID response and recovery are focused on best practices that are happening right now and learning about, contemporary science and disease epidemiology and really good stuff about moving forward. I do want to just highlight, though, that Indigenous people, particularly in this area, have been facing challenges for tens of thousands of years, and there is a lot of really great Indigenous knowledge about how to face community challenges and get over hurdles. And so I'm thinking about how we can connect a lot of that intergenerational Indigenous knowledge to bring that together with some of the best practice that we have in the mainstream to really create some innovation. And when I think about the 4 leads across 7 themes, I just wonder if it makes sense to have a theme that focuses on reconciliation within recovery. I think about where we are in the City of Toronto with the emergence of the Indigenous Affairs Office. I think of where we are in the context of this pandemic, and I see ahead of us a pathway that's going to be very transformative. And you rightly said we want to return to normal or better, and I do believe we will be reimagining change in a lot of our systems and structures and services, and I think there's an opportunity here. I think there's an opportunity here for Indigenous leaders across the social services and business and academic sectors to work with this new office to ensure that there is a firm focus on decolonization and reconciliation, not only to benefit Indigenous folks living in Toronto, but really to provide Indigenous innovation for all Torontonians. And so I just would like to know if that's something that makes sense to you or that you might consider thinking about the addition of a theme around reconciliation and recovery and how we might create mechanisms to work together to achieve that.
Thank you. You raised some very interesting and, of course, valuable points. Let us take that away and figure out how to address that in a helpful and responsive manner. I think the focus on rebuild and reimagination is, I think, a very good point for sure.
Thank you, Mr. Ravi. Okay. Last chance for questions from the committee before we move on to our second presentation. Okay. So we will now move on to our second presentation, folks. We have Denise Andrea Campbell, the Executive Director of Social Development, Finance, and Administration, We're also joined by Marianne Bedard, the General Manager of Shelter Support and Housing Administration, and Abigail Bond, the Executive Director of the Housing Secretariat. They're here to provide a presentation to the committee. Welcome, and thank you for your time today.
Thank you very much. Good morning. I'm Denise, the Executive Director of Social Development. Thank you for the invitation. Social Development, Finance, and Administration drives transformative change to achieve stronger, safer, and more resilient communities and neighborhoods in Toronto. We support community capacity through investment in community grants, and by providing community development services directly in neighborhoods and to resident leaders. Our work has taken on an increasing urgency during the COVID-19 pandemic, as we rapidly and relentlessly mobilize a host of services and supports to minimize the impacts of the closures or suspensions of support services that residents usually rely on. I will quickly highlight some of the important work that we have been doing over the past 10 weeks to support Indigenous communities and other communities during the impact. Next slide, please. Sorry, and keep going next one. Thank you. So, in approaching this work, we like to build a city that supports. With community partners and other orders of government, the city is taking action to support vulnerable residents to stabilize their lives during the COVID-19 pandemic. 8 priorities guide our response. To create the most seamless support systems possible, we have been strategizing, coordinating, delivering, and monitoring these efforts using a pandemic-focused framework entitled TO Supports. COVID-19 pandemic has exposed social and economic inequalities that have long existed in our city, as many of you know. And so our response is mindful of systemic inequalities and takes steps to ensure populations most at risk are supported. This includes Indigenous peoples, Black Torontonians, those experiencing homelessness, LGBTQS communities, and newcomers. We have teams assigned to each of these 8 priorities. Those teams have been developing and implementing a variety of actions and initiatives to stabilize the lives of vulnerable residents. The areas in green indicate actions launched to date to advance these priorities. And as you can see at this stage, critical action is being taken in all 8 community response areas. Next slide, please. The community sector has been a vital part in serving residents, and that work is even more important during this emergency. So early on, in partnership with United Way, we established a community coordination plan to work with local community organizations in a grassroots model to quickly identify issues, needs, and enact and implement solutions. This work includes the establishment of 13 clusters of community agencies working across Toronto, including 1 cluster for Indigenous serving organizations specifically. This new model of working has harmonized the efforts of staff from the city, United Way, and over 340 local community agencies. This work is urgent, responsive, and impactful. Just to highlight, it has helped achieve over 6,000 households served with food hampers through Toronto Public Libraries over the past 8 weeks. And over 42,000 student families supported with food gift cards. Over 12,000 free mental health support calls, and over 210 sessions held to coordinate valuable information to community agencies in serving residents better. Next slide, please. In doing our work, we remain guided by the principles of reconciliation. This includes Indigenous-led organizations informing and guiding our responses. To support Indigenous-led organizations more specifically, the division that I work for, Social Development, has allocated $175,000 to the Toronto Aboriginal Support Services Council early on in the pandemic to support member agencies, and we leverage United Way support additionally. Recognize that the need is far greater than that investment to date, so we are working with the Indigenous Affairs Office to process additional funding to Indigenous communities through Indigenous organizations. Mental health supports is a critical need at this time. Accordingly, we have partnered with Native Child and Family Services to be a lead agency receiving referred calls for help from 211. We've also launched a mental health support services website and social media outreach plan that specifically engages Indigenous communities with Indigenous-focused resources. Next slide, please. So on this final slide, I just want to acknowledge that food access has been by far one of the most pressing issues facing many Torontonians during the pandemic. Working with Indigenous partners, we have secured over 10,000 in grocery gift cards and donations from Metro to the task agencies. Ensure that Toronto Council Fire Native and Native Cultural Centre, Native Canadian Centre of Toronto, Native Women's Resource Centre, and the Native Child and Family Services among 37 organizations to receive weekly prepared meals through a partnership between the city, MLSC, Second Harvest, and United Way. Systemically, we know that COVID-19 disproportionately impacts Indigenous communities. So we must collect relevant data to shape preventative measures and support our community responses. Our data for equity policy work is deeply timely. We're advancing it in consultation with Indigenous Affairs Office and Indigenous organizations and researchers in order to support Toronto Public Health to do disaggregated data on COVID impacts. We've also engaged TASK in the Social Services Work Group chaired by Deputy Mayor Bailau to identify mid to long-term recommendations to advance the recovery needs of Indigenous-led and serving organizations, alongside others in the community sector. And we are refocusing and prioritizing now the completion of the Urban Indigenous Poverty Reduction Action Plan, approved by Council during the 2020 budget process. We will continue to work with Indigenous-led community agencies to support Indigenous peoples and to shape and build recovery efforts so that they are relevant and effective. Thank you for your time, and on to my colleagues.
Thank you, Denise. I believe my SSHA section is next. If we could go to the next slide.
Yes.
And thank you. So the purpose of my update today is to share with the committee all of the actions that SSHA has taken to date in response to COVID-19. And in addition, how those actions have an impact on Indigenous organizations and Indigenous peoples experiencing homelessness. So since the onset of COVID-19, SSHA has been working tirelessly with many other city divisions and the provincial and federal governments and the broad nonprofit sector to rapidly tailor solutions to protect the cities most vulnerable to COVID-19. We do have the largest shelter system in Canada. Before COVID, we were sheltering about 7,000 people per night. Since the beginning of COVID-19 back in March, we have opened 31 new programs in order to promote physical distancing in the shelter system and also to provide isolation and recovery space for people who are suspected of having COVID-19 or confirmed of having the virus. We know that people who experience homelessness are particularly vulnerable to this virus. It is a respiratory illness. And as such, people with underlying health conditions and disadvantaged socioeconomic conditions are particularly vulnerable to this virus. So at the beginning, our overall objective was to keep COVID-19 out of the shelter system for as long as we could, to allow us some really critical time for planning. Given the scale of the pandemic, we knew that despite our best efforts, it would unfortunately only be a matter of time before COVID-19 was present in the shelter system. And as of yesterday, we had 193 active cases of COVID-19 in the shelter system, 437 cases cumulatively across the whole sector, which, although the number is high, still only represents 6% of the shelter population. Next slide, please. We know that Indigenous people are overrepresented in the homeless population in Toronto. While they represent 2.5% of the Toronto population, they represent 16% of the homeless population, with an even greater proportion experiencing street homelessness. And that is why we are committed to continuing to work in collaboration with this committee and with our Indigenous organizations to ensure that our response and recovery efforts meet the needs of Indigenous organizations and people experiencing homelessness. Next slide, please. As I've spoken to this committee before, in 2018, we launched the Meeting in the Middle engagement strategy and action plan that was co-created to foster better relationships with SSHA and Indigenous organizations. And I want to say we remain committed to this partnership and working with our Indigenous partners in the housing and homelessness sector directly in response to COVID-19 and making sure that it's in keeping with the principles and commitments that were made in Meeting in the Middle. Next slide, please. So I want to tell you a little bit about our response. Given that this was a rapidly evolving situation, the critical need to respond to the needs of people experiencing homelessness, we worked very quickly to develop our response initiatives. At the very beginning, we conducted an impact assessment to determine the greatest areas of risk in the shelter system, and this was done in conjunction with Toronto Public Health. From there, we developed our three-tier response, which to date has focused on prevention by creating physical distancing in the shelter system and other 24-hour services, mitigation through the screening process and referral to testing and isolation, and the development of recovery programs in partnership with the health sector. And we have rapidly implemented this plan, mobilizing our response on an urgent basis so that we can be prepared as possible and stay one step ahead of the virus. Next slide, please. I'd like to provide the committee with an overview of some actions and commitments that SSHA has undertaken to support Indigenous agencies in our COVID-19 response. We have provided $162,000 in funding to Indigenous shelters and drop-ins, specifically for infection prevention and control, personal protective equipment, and wage enhancements for frontline staff. We are distributing a safe supply of masks to Indigenous shelters to support the daily use of masks by all frontline shelter staff. And we have been working with Indigenous shelters regarding access to hotel rooms to create physical distancing. And we've provided 40 hotel rooms that are specific for Indigenous organizations serving people experiencing homelessness, as well as access to the broader hotel rooms that we have secured. We are also working with our community outreach partners, which include Taname Res, to refer people staying in encampments to our interim housing program. This opened up 2 weeks ago. It is currently sheltering 150 people. 24 of those identify as Indigenous, so about 16% of the referrals to that program have been Indigenous. Next slide, please. We know that regardless of this pandemic, the best and only solution to homelessness is to provide people with permanent housing. So in addition to measures that I've already spoken about, we are also trying to rapidly rehouse clients during this current situation and trying to take advantage of this to create longer-term solutions to homelessness. So as part of the city's response to COVID-19, we have developed a rapid housing initiative that was started in March of this year. This is in partnership with Toronto Community Housing and the City of Toronto, utilizing our coordinated access system, where we match people with available units directly from the shelter system. They are matched with available RGI units, and as I said, through our coordinated access system. Clients are referred through the shelter system, and they have to be eligible for RGI, require a low level of support, and be willing to accept those follow-up supports. SSHA has met with the Toronto Indigenous CAB to explore opportunities for collaboration to ensure the allocation of additional units for Indigenous shelter users. Next slide, please. In October 2019, SSHA, along with the Toronto Indigenous CAB and the Aboriginal Labour Force Development Circle, signed a memorandum of understanding to outline how we will work together on the development of an Indigenous funding stream with an allocation of 20% of grant funding specific to Indigenous organizations. And we are committed to the creation of that funding program and the allocation in collaboration with the Toronto Indigenous CAB and AFLDC. And we're looking at ways to establish this as we move into our service system planning next year. Next slide, please. We are working on a recovery planning post-COVID-19, and we've committed to a distinct and separate engagement with the Toronto Indigenous CAB. And we've had some of those preliminary discussions last week, and they will continue. This includes working with the Toronto Indigenous CAB around long-term housing opportunities for Indigenous people experiencing homelessness, and continued collaboration with the CAB and the Coordinated Access Subcommittee of the CAB in development of our coordinated access system to make sure that we are meeting the needs of Indigenous peoples experiencing homelessness. Miigwech.
Thank you.
Good morning, this is Abby Bond. I believe my slides might be next.
Yes, welcome.
Thank you. Okay, can you see the slides? I can't see them right now.
They should be up in a moment. Yeah, here we are. Yeah.
Okay, no problem.
Apologies, I think I missed a couple of my my slides. That's why mine are still up there.
We did have one on the recovery strategy engagement, Marianne. I don't know if you want to speak to
Yes.
that quickly.
Yes, so the last slide here, as I said, we are committed to the distinct engagement with the Indigenous community and working through our coordinated access system. I think I just forgot to tell you to flip the slide there. Sorry.
Thank you.
Good morning. My name is Abby Bond. I'm the Executive Director of the Housing Secretariat. Thank you very much for the invitation this morning to present to you, and it's great to almost meet you, and hopefully we will be able to meet in person soon. So next slide, please. So today I wanted to take you through some of the things that we've been working on during this COVID period, and to reassure, I think, yourselves as the committee that the work we're doing is still very much grounded in the work that we did and brought to you on the Housing TO plan. So that Housing TO plan that we, I think, talked to you back in December of last year was very grounded in data and information that we have on Indigenous housing demand and supply. We know that 35% of Indigenous people are precariously housed or homeless. And as you can see from this slide, over a third of Indigenous adults report giving up key needs for example, groceries or transportation to meet their shelter housing costs at least once a month. So we know that those issues will be highly pressurized, or more pressurized, I should say, during this period of COVID, and the results of people losing their jobs and more issues around housing. Next slide, please. So just a reminder, here's were some of the organizations that were worked with us on our housing TO plan, many of which are connected to this committee and some of which I've had the pleasure of meeting since I joined back in February. Next slide, please. And one of the reasons I wanted to just touch on what we heard from our partners and the importance of our housing TO plan is as we've entered this period of COVID-19, it's become even more obvious to all of us of the connection between health and housing and how important housing is as a determinant of health, specifically during this period, and how if you don't have a home with a front door that you can close, you can't self-isolate, you can't really practice physical distancing. So our plan that I'll talk about a bit more becomes even more important. So what we heard from our Indigenous partners was some of the challenges that they were having with regard to development of affordable housing in Toronto. So hard to buy land, the housing that was being developed was unaffordable, rent was expensive, there wasn't enough funding to support people moving from homelessness into housing. There were lots of ideas that people shared with us during that engagement process, many of which I believe you're familiar with. And so a key step for us that we were starting to embark on was we had a follow-up discussion with key housing stakeholders as a result of this feedback that we got at the end of February, just before we went into this kind of COVID period. We had a great discussion at that meeting about what concrete steps we could take along with our partners to progress housing supply, specifically for our Indigenous population. And key next steps were really to follow up with the sort of 5 or 6 key housing providers, Indigenous-led housing providers, to do an inventory of all key projects that they were working on, and really to look at our housing demand and waitlist information a little bit more. And so it's our intention to continue that work, and we'd hope to report back to you in June with the results of that. But I think we need more time to connect with those people, as with everyone, it's been difficult to continue to keep some of this work going during this period, but we now think that we can turn our attention to those next steps, and very timely in terms of some of the funding which we hope will become available. Next slide, please. And so again, as I said, it's become so important that we continue to progress our housing TO plan. It was improved, if we can believe it, before COVID. However, the 13 actions that we identified, as I said, have become even more important for us to focus on during this period. Specifically, we identified this plan would cost around $23.4 billion to deliver over the next 10 years, needing very substantial investment from other levels of government. And particularly as we're looking at those 40,000 new affordable rental homes, including 18,000 supportive homes, we know that we need to work with all partners to try and deliver that. And specifically, our focus in the last little while has been how can we accelerate that delivery? How can we accelerate that funding to respond to the challenges we now face? Next slide, please. And so specifically what we've been doing during this COVID period, we have also been working on one of the city's advisory groups, and working with the social services and housing working group that's been led by Deputy Mayor Bailao. And that stakeholder table, at least one of, I believe, your committee members has been involved in that. It's been very important from us to hear back from renters, landlords, the private and non-profit and Indigenous housing sector about their most pressing issues during this period. And we've heard loud and clear that although the immediate challenge with regard to potential evictions is on hold, while we have an eviction moratorium, there are still significant issues facing renter households. And we see those challenges often concentrated into areas of poverty or even buildings that have a higher degree of poverty in them. So one building may have renters who are not really having any major challenges paying their rent. Another building might be seeing 50% of renters in difficulty. So there really is a broad spectrum of issues facing our community. And obviously we have, along with our partners, concerns about what might happen once the province lifts that moratorium on evictions. So as part of this work, we've developed, or we are developing, a policy action plan, which we hope will be public within the next couple of weeks, and where we've looked to explore ideas to support calls for expanded rental assistance and for more measures regarding economic renter evictions after the immediate crisis. During this period, we've also tried to consolidate and refine information on our website for both renters and landlords to make it easier to find information about COVID to help them to respond and deal with issues that arise during this period. Next slide, please. And so, as I mentioned, we're looking to accelerate the housing plan in terms of responding to COVID and as part of our recovery focus. But this is very much grounded in our belief. It was very clear in our housing TO plan that supportive housing as a type of housing provides a great opportunity to move people from homelessness and create housing stability and really help solve our issues that we're facing. So that has really been the focus for us. How can we further accelerate the delivery of supportive housing? Next slide, please. And one of the ways that we're doing this, and I wanted to talk to you a little bit about this today, is through modular supportive housing. Here you can see a photograph of the first modular housing development from Vancouver, which was delivered back in 2018. And this project that I worked on when I worked in Vancouver was instrumental in unlocking a real growth in supply of supportive housing. It was a great learning opportunity for us, and it's something that I've been working on with the team here in Toronto to try and accelerate for our own community. So modular supportive housing is really just using the technology of modular housing, which is very well developed across Canada, often in other communities up in the north of Canada, to use that technology to deliver permanent supportive housing for those people who are experiencing homelessness and facing multiple physical, mental, and addiction challenges. So the idea is that we deliver supportive housing with 24/7 staffing, often with a food program and a commercial kitchen and shared amenities. And we're able to deliver high quality and affordable homes. They will all be building code compliant, offer a higher degree of environmental sustainability, and it gives us the ability to deliver this housing much more quickly than we would normally deliver housing in the city. If to the next slide, please. So this is a picture from inside one of the homes that we developed in Vancouver. This is the kind of suite that would be offered with kitchen, bedroom, and dining facility. And a few weeks ago at council, seeing the urgency of this kind of how much this kind of housing is needed, council actually supported the introduction of our modular housing pilot. So we're moving forward on delivering 110 new homes by the end of September and a further 140 homes like this by Q1 of 2021. So that was an important decision by council and reflected council's commitment to invest directly in the delivery of homes like this, along with our partners at CMHC and the federal government. Next slide, please. And here's just a picture of one of the buildings from Vancouver to give you a sense that these are multi-residential buildings. They fit well into community. They are not substandard. They're high quality homes and provide a really great opportunity for us to accelerate our delivery. Next slide, please. And so lastly, I just wanted to focus on some next steps for us. As I said, we have moved ahead on our phase 1 modular supportive homes, and we anticipate rolling out our consultation on the first 2 sites very shortly. To help us deliver on that, we're also going to be issuing an RFP looking for a non-profit housing provider. to help us manage these homes over the long term, and we're very keen to engage Indigenous nonprofit housing providers in that process. The phase 2 of modular supportive housing will likely start to be delivered by the end of this year, with openings in Q1 of 2021. And leading out of the policy work and discussions that we've had with key stakeholders, it's going to be very important for us to shift to advocacy or further advocacy to federal and provincial partners to make sure that they understand how investment in affordable housing, in modular supportive housing, can not only benefit individuals, but is a vital part of our recovery as it creates jobs as well. So there's going to be a big shift for us in terms of advocacy to both levels of government. We also hope later in the year to issue our open door call for proposals, which is where we offer incentives and financial investments to those nonprofit partners and private sector partners who want to deliver affordable housing. It's important for us to do this potentially to take advantage of any recovery investment that might be coming from the federal and provincial government. So we hope to do that later in the summer. And again, as I said, following up with our key Indigenous housing providers, again, to find ways to support capacity for the growth in new Indigenous housing. That's going to be a next step for us. So we're hoping to have that meeting again later in the summer. And finally, to see as we develop this housing, whether there are specific opportunities to really target those solutions, particularly for Indigenous women and Indigenous youth. That's all of my slides. Thank you, and I'm happy to answer any questions.
Thank you very much. I'd just like to turn things, I see Angus quick at the draw with his finger in the air. Angus?
Yes, thank you. I have questions for both Marianne and for Abigail. Marianne, in a couple, that's quite a fuzzy picture. There we are. In a couple of places, Marianne, you referenced the Rapid Housing Response Program and housing folks who were on the coordinated access list with TCH. So you would know that the City of Toronto has recognized alternative housing providers and has said to alternative housing providers, Wigwaman included, that they're permitted to keep their own waiting list, and that Indigenous seniors, singles, and families are not required to be on the coordinated access list. And indeed, it's the case that there are many, many, many people who have expressed an interest in being housed through an Indigenous agency, but haven't actually put themselves on the coordinated access list. And you referenced the same coordinated access list around the issue of portable housing benefits. So I'm wondering if you could just speak to us around what steps are being taken to ensure that the alternative housing providers who have literally hundreds of Indigenous households on their list who are not on the coordinated access list, that those people who are on the alternative housing lists have the same opportunity for access as those people who are on the coordinated access list.
Thank you for your question, Angus. And you know what? I don't have an answer for you today. I do know that our coordinated access team have been working through eligibility for that. We've been working directly with all of the shelter providers to identify clients that are within the shelter system. That's the focus of coordinated access. And then connecting out from there with any housing provider, including social housing providers and private market rental, to identify places that we can match people to stay. But let me get some more information specific to you on the alternative housing providers, and I'll provide that for you. I'm sorry I don't have the answer today.
Super, thank you. And to Abigail on the modular housing question. So there's an RFP that's going out in June for modular housing, and the city's going to be looking for operators.
That's correct.
I'm wondering if you mean operators or whether you mean owners. And if you mean operators, I'm wondering why we're talking about operators and not owners, where the housing, whether it's modular or otherwise, is vested in the ownership by nonprofits and Indigenous controlled nonprofits.
We are talking about operators for this RFP. For this pilot, our approach has been to directly invest for the city to be the owner to purchase these modular homes, and using money, both a grant and a loan from CMHC, from our federal housing partners. We aim to provide a long-term lease, so likely for the life of the building, for a nonprofit operator to manage that building from day one all the way through to the end of the building. That's very much in line with some of the other approaches that the city has used, where we have used long-term leases. We've also heard from communities, not just Indigenous nonprofit housing providers, but others, that there is an interest in kind of having those assets vested directly in community. It's something that we continue to look at, but primarily our aim with this initial pilot was speed, to get those buildings open by the end of September of this year. So we did use a model that we've used before, but we are open to further discussions, or especially on other projects around having those assets owned by the nonprofit community.
A couple of follow-up questions. It is the case, of course, that the city has leased land on long-term leases. It may be the case that the city has leased the buildings themselves. The model that I'm familiar with is where the city retains ownership of the land, but the buildings themselves are owned and operated by the nonprofit. And so I would say that I think that's an issue in terms of the development of capacity within the Indigenous community. I think the capacity is developed through ownership, and developed less through operations. I would say also that I'm struck by the modular concept is one thing, but there seems to be a link that's sort of permanently established between the concept of modular housing and supportive housing. And I'm wondering what consideration the city has given to supporting modular housing, which is not supportive and which is designed for families. Because I look at those rooms that you illustrated, and those rooms are SROs. SROs, I think that's the phrase, single residence occupancy. Those are not going to be appropriate for families. And I think that's an issue. There's a significant waiting list within the Indigenous community for affordable housing that's not just for singles, but also for families.
Yes, you're right that there is definitely a need for us to develop appropriate family size accommodation. That hasn't been the focus of our initial pilot. Very much the first 250 homes, we wanted to urgently respond and accelerate our approach to people who are experiencing homelessness. So it's been very much focused on singles. It's not to say in the future modular housing doesn't lend itself to other forms of housing. It just wasn't our initial choice in terms of that pilot. And it was very much supporting people who are living in shelters or out on the street to come inside to a permanent home as quickly as possible. So it's really the link between modular and supportive. Doesn't have to be the only link to modular. Modular will also lend itself very well to doing other types of housing. It was just our priority was actually supportive housing, and modular was the fastest way to deliver that.
Just one last follow-up question. which you may know the answer to, I don't know. So when the city was doing consultations around the housing, housing now, housing TO, whatever it is with the city sites that are going to be leased for 50 years, there was talk and there was a commitment, I thought, from the city to provide, I thought it was like $1 million in funding to be made available to nonprofit housing proponents and other affordable housing proponents to assist in the development of proposals, to help defray the costs of the development of proposals. It's an expensive proposition. We put in a proposal, as you know, to on one of the sites. We didn't get selected. That's life in the big city. I'm fine with that. But it wasn't cheap. And I'm wondering what the city has done with its commitment to roll out funding to help defray the costs of the development of proposals for affordable housing.
Yes, you correctly identified that we had said that we would provide money to build capacity in the nonprofit sector. It is still something we're looking at. It's not something we've been able to take too far forward during this period, but it is still something that I'd like to bring forward by the end of the year.
Thank you.
Thank you. Any other committee members who have questions for this group? I see Steve Teakins. Steve.
Okay. Good morning, everyone. And Marianne and Abigail, really good to see you, even though it's not in person. So I guess a couple things. First of all, since NAMI has experienced a couple cases of COVID, March 24th and 25th. And Marianne, in one of your statements saying that SSHA is supplying, PPE to shelters. We've been offered maybe 3 times from SSHA PPE, but that's it. Initially, when we had our COVID cases, we had a small supply of PPE, and thank you, it was appreciated. And then secondly, a few weeks ago, we were offered 2 pieces of PPE for Sagate and 27 pieces of PPE for the Namurid shelter. Now, that's not nearly enough of what we need. Thankfully, what I've learned through this COVID crisis is Namurid, we need to rely on ourselves and our own resources, because if we rely on the city, we'd have a bigger pandemic on our case than what we initially had. So, the statement you made, Mariana, around SSHA is supplying PPE to shelters, that's not really the case in Namurid's perspective. Is there an intent by SSHA to moving forward to ongoing supply PPE to shelters and adequate levels? Because so far what we received from SSHA has been not enough. I guess that's my question on that. And then Abby, I have a question for you afterwards.
Thank you for the question, Steve. Yes, I mean, I think the issue of PPE is one of the pieces that has been a bit elusive, because we've been finding out a little bit more about the virus over time. So at the initial understanding, we've always followed public health advice on what PPE is required in shelters. And at the beginning, although many people wanted a PPE, it was not at that time a recommended practice. However, what we did do, a couple of things we did do is we did, as you said, that initial distribution of PPE, so that when it was required in shelters, when you were directly working with somebody who you felt was symptomatic, that PPE would be available. We did do one delivery of PPE out to the community agencies. And that was at a time when the city itself had very limited stock for our own, broad city systems as well. But we felt that this was significantly important enough to utilize some of that stock out to community agencies. Knowing that we didn't have a lot of stock to share, we also provided all of the Indigenous agencies with funding so that, as you said, you could be responsible for purchasing your own equipment, but we would provide the money to do that. And so we've done that. Since the city has been able to build up their stock of PPE, we have been doing more regular deliveries of PPE out to community agencies. But again, based on the requirement that PPE only be used when somebody is not able to maintain a 6-foot distance away from somebody, or they were directly interacting with somebody that was symptomatic. So again, encouraging the limited use when appropriate, as per the public health requirements. In the last couple of weeks, that stated, and we have started providing all shelters with access to masks for frontline staff to use. The recommendation is 2 masks per staff per day. And so we've reached out to all the shelters. We've identified what that stock is, and those deliveries have started to enable you to distribute those to your staff. So, I apologize if you feel that that response has been inefficient or insufficient. But we have done our very best to try to make sure that where we can't provide materials, we are providing money, and when we can provide materials, we are doing that according to public health guidelines.
Thanks, Marianne. Abigail, I noticed at your slide, the last little bullet point you had, it talked about housing, and it named 2 groups. It named, focus on housing for Indigenous women, as well as I think it was youth. And Namaris, we work with men, and if you look at all the past street needs assessments, the highest proportion of Indigenous homeless people are men. And more so men than any other segments of the population that's measured in the street needs assessment. So why was a priority given to youth, where in this last street needs assessment, I believe the youth homeless population was less than 10%, and females? Can you explain how that determination was made?
Yeah, thank you. So those were 2 examples of where we might focus moving forward, not exclusively. And you're right, men show up very predominantly in any street or sheltered homeless count. We're also aware that women, and specifically youth, often don't show up in those counts, but are experiencing some of the same issues. So I guess what we all would refer to as more hidden homelessness. And so in terms of moving towards an equity approach in terms of delivery of housing, it's important for us to ensure that we have a focus not just on those people we see, but also those people we know are also struggling. So we're not suggesting that we're going to exclusively prioritize those groups. It's just so that we can that they stay on our mind in terms of when we are partnering with agencies and trying to ensure that our services are inclusive. So it's not our intent to exclude Indigenous men from any of the housing that we're going to be producing, certainly not the modular supported housing.
Thank you.
Thank you.
Thank you, everyone.
Pam Hart, I believe you had your hand up. Do you still have a question?
I do. Thanks. Hi, everyone. Thanks for your presentations. I just had a couple of comments that sort of stood out for me. One was around the safety and well-being priority and the team that I guess is addressing that. When the presentation started, You had mentioned that you were going to explain a little bit about how the Indigenous community was being supported in the last 10 weeks. So I'm just wondering if there's anything you can add to specifically the safety and well-being priority, and or if there's any other documentation around the efforts that have been done to date for safety and well-being for Indigenous people. Specifically, my interest is obviously Indigenous women and children. There was also a mention of the 40 beds for the Indigenous community, and I don't know what agency they went to and if that agency feels comfortable sharing, but Native Women's did reach out to the city and request beds for Indigenous women and children who are fleeing domestic violence and who are in high-risk situations with a refusal to that request. And so Native Women's had negotiated their own hotel, and we have secured our own hotel rooms for women who are in dangerous situations. And so I understand that Native Women's isn't a housing or shelter agency, but due to COVID, we've kind of shifted gears and are sort of in the game of housing. We've relocated women, we've created a hotline, and we continue to get calls to relocate individuals and families. So I see the work that's happening and the responses, and they're great, and they're definitely tapping into areas, but I continuously am feeling that there is a gap when we're trying to address Indigenous women and their safety and those fleeing domestic violence. There isn't many places for them to go. And we're now starting to see women who want to relocate into the city because they've heard about our hotline from other locations, from outside of Toronto. And so we're responding to that. And again, there isn't many places for them to go except for what we've created for them. And so I'm just wondering, is there a VAW response? Is there a lens looking into the gaps that are being created? We don't have a streets to homes team. We can't go out and look into the encampments and figure out which women could use our services. I do know that a woman was housed through that program into an apartment, which is amazing. However, we weren't a part of that process, and I would imagine that if we were involved or had access to being involved in these programs and initiatives, that woman would then get wraparound services from us and some key cultural supports that likely she could use since she's transitioned from living on the streets into an apartment. So those are some of my thoughts. I welcome your feedback and comments on that. And as far as the priority section, I don't need the details now, but if there's something that maybe can be sent along for review, I would greatly appreciate that.
Sorry, Marianne, go ahead.
Sorry. So I was just going to respond to your questions about the hotel rooms. Certainly, we're using hotel rooms to create physical distancing in the shelter system. We're not using them for housing, and that is why we've been focusing on people who are in shelter. We haven't been expanding our system. We've been moving people out of existing spaces and into hotels in order to create additional spaces. So that's why there hasn't been sort of the new intake. We've been working with Council Fire on the specific hotel rooms that I discussed, as well as Namaires housed some people in hotels that we supported as well. And I think there was one other, but I can't remember off the top of my head at the moment. The VAW sector, as you know, is a provincial sector. It's not part of the city's shelter system. We have been advocating consistently to the provincial government to ask for a VAW shelter response, for them to be able to provide similar supports that the city is currently providing to the shelter system in order to provide the opportunity for that VAW sector to create physical distancing and perhaps increase your footprint as well due to the need during COVID-19. in lieu of that, we've also been working with the VAW sector to try to, as you said, connect women who are fleeing violence with available social housing units. So they do get priority placement into social housing. So we have been, following the appropriate process when a unit comes up of going through the wait list, but also providing priority to people, women who are fleeing violence. So we have tried to do as much as we can within our own system and within our own resources to support the provincial system, in addition to, advocating for them to come to the table directly with those supports for the system.
And perhaps just to add to Marianne's point, so around the TO supports priorities, we wanted to acknowledge and anticipate the fact that domestic violence as well as child abuse cases we would see a rise in across a number of communities as people practice isolation and quarantine over the last number of weeks. So to Marianne's point, the challenge I think for us in coordinating a response at the city is the recognition that this wasn't necessarily a time to take on new roles. As Marianne said, VAW is a provincial response, so we've been lending our voice to that advocacy as well. But primarily, our work has been around coordinating with community agencies and residents to see what is possible within the city's role to be able to support escalating incidences of domestic violence and child abuse as well. I think that we need to do more, or that more could be done, and so I would welcome the opportunity through Selena to follow up with you for further conversation on what our community safety and well-being team could do in partnership to support particularly a community agency response to these issues.
Thank you, Marianne and Denise. Just as a follow-up, I do appreciate what was shared, and I also do appreciate that the VAW sector is provincial, but I also believe that the city has committed to responding to the missing and murdered Indigenous women inquiry and implementing some work in that area. I'm just wondering if SSHA is responding in that way, and if that is a potential avenue to get at some of the critical services for Indigenous women that Pam's speaking to.
Thank you. Yes, that's an excellent point, and we are very committed to that. We need to do it in collaboration with the provincial government because it is a provincial system. But I think where we've been focusing is on the connection between that sector and our ability to house people in the social housing through the priority placement. So, I'm happy to have further discussions about how that might happen. But again, within the shelter system, really, we have been focusing on physical distancing, not about enhanced capacity at the moment, just because we just don't have the ability to do that under these circumstances. But in terms of connecting women directly with housing, there's absolutely opportunities there.
Understood. Thank you. Abigail, is the Housing Secretariat doing anything around murdered and missing Indigenous women in the context of COVID-19? Are there particular temporary supports that are being looked at in your area?
It's not something that we have focused on during the COVID-19 period, but as I mentioned, that focus on services and housing for Indigenous women definitely needs to be part of our recovery response as we roll out new housing supply for all of our residents who need supportive housing, thinking about how we can connect with organizations who provide services to women, both fleeing violence and also in need of supportive housing, is going to be an important part of that. Because as I mentioned, often women who are most at risk don't show up in some of the kind of the data and the information that we often collect, but we know when we see the really, really bad results of systemic violence against women. So it's definitely going to be part of our response moving forward.
Thank you. Very much appreciated.
Can I just add just a comment before we move on? I just wanted to point out that it was already mentioned that Indigenous women are sort of the unseen homelessness. So while we're talking about VAW, violence and homelessness aren't two separate things. They're very fluid. And so women who are experiencing violence are likely experiencing homelessness, or they're staying in the abusive situations. So while they're unseen homeless, there's also unseen violence, and it's all very fluid. So while I do respect that there's separations and there's different parties at hand that need to respond to this, Native Women's has responded to the issue. And so I think that there's room to have a better conversation around the response to this. And so I just want to leave it with that, please. Thanks.
Thank you, Pam. Are there further members of the committee that have questions or comments?
May I go ahead? Yeah, it's Steve here once again. Marianne, NAMI-RES, we've been getting better at social distancing. I just received a report last week saying, at the NAMI-RES shelter that our social distancing new capacity now should be at 55. We're going to go back ourselves and measure that. We feel it's a little bit high. And I know when we're at 50, we had some challenges with social distancing at that number. So we're going to go back and we'll probably talk to the SSHA staff and try to negotiate a new number for that. But I'm looking ahead at doing intakes. I don't want to do them the way we've done them in the past. At NAMI-RES through our own volition, on May 5th, we partnered with Women's College Hospital and had them come in and do testing of all our residents. We had an 82% uptake, and then some of the guys that missed the testing, they went later and did it themselves. So at the end of the day, the end of that week, we had 98% of our residents get tested and everyone came back negative. So when we look at doing intakes again, I want to partner with somewhere to do the testing, and so that say we have a guy who wants to come into our shelter, and we say, okay, you go out and get tested. After your test, you stay in isolation, and then once your results come back and they're negative, then we'll intake you. That's what we're looking at. I'm just wondering, is SSHA looking at maybe perhaps using rapid tests? I understand they're out there, but from what I've heard, they're not widely used. So has SSHA given any consideration to accessing those rapid tests and using it for the purposes of when shelters are ready to do intakes again, that they can do it with confidence, knowing they'll be doing an intake with someone who is negative for COVID?
Sorry, I'm just writing down those points because there were a number of points that I want to make sure I address in my response. So your first questions were around the capacity at the shelter, and absolutely. So the numbers that we sent out to each shelter provider was based on a space analysis that we did in 2017. So based on what we're seeing on paper, we did an estimate of what we thought the number would be in your shelter. Just to give you a starting point, we're working with operators to say, is that actually the number where you have achieved it? Some people are higher and some people are lower. What we've done is we've sent out a survey to all of our providers to say, we identified, say 50 is your number. Once you've reached 50, do you agree that you've now created physical distancing in your shelter? And if not, why? And how are we going to address that? And then we follow up with a QA visit, quality assurance visit, to confirm that physical distancing has been met and that there is an appropriate new occupancy established for that program. program. So the number absolutely open to discussion as you move forward, and our QA staff will be following up with you once you complete that survey and send that back in. I think the deadline is Thursday. Regarding the testing, very similar to PPE, our access to testing is through the provincial health system and through public health. And the direction on who and how people get tested has also been evolving. So at the very beginning, you could only get a test if you had traveled or if you were exposed to someone who had traveled. And then it sort of progressed from there as we learned more about, symptoms and exposure and those types of things. We are currently, there is still not provision for mass testing through the provincial government. We continue to advocate for that as much as we can. What we have done is we've provided a list of priority shelters for mass testing so that as swabs become available, we can focus on those areas. And working with public health, where they see those priorities is shelters that have had cases of COVID currently. So they're currently considered in an outbreak, which is one or more people, and they're going to those sites and doing mass testing. So we're working very closely, and where a hospital has gone into sort of a private arrangement with a community organization that is outside public health or Ontario Health, we've been very supportive of that arrangement, but that's not something that we have access to. But we have been working very closely with public health to make sure that we are able to get access to testing as much and as quickly as we can. Who knows now that the sort of provincial advice on who gets tested, has changed again this week. Maybe that will have an impact on the protocols that are available to us. I think that was all your was about the intake.
That's right. Yeah.
Yes, so we are definitely looking at that. As I mentioned in my presentation, we're starting to do that recovery strategy. We'll have a recovery strategy in place by the end of June, and those are some of the questions that definitely will need to be considered. Some of the logistics in there may be difficult. So, where are people going to isolate if we're going to isolate every new person into the shelter system? What does that look like? How do we access ongoing testing? How long do people isolate? What's realistic? So definitely great questions, and definitely ones that we'll be exploring as we move forward with our recovery strategy, and we'll be having conversations directly with the Indigenous community about what that looks like for sure.
Thank you. Many thanks. Any further questions from the committee?
I have a couple. Is Francis?
Go ahead, Francis.
Okay. First of all, Abigail, talking about your modular supportive housing, just from looking at it, there's no storage, there's no room, and there absolutely would not be any good for a mom and kids or a dad and child or anything like that. Are you going to consider with your first wave of modular homes, because the women with children who are under the umbrella of BAW are going to be, they're looking right now. They need someplace right now. And I don't want to punish them by making them stay where they are or having them, into a shelter. This would be an ideal. I would like to see a percentage of your new units, your modular units, be designated for a percentage of them for women against BAW. violence against women. But they sure as heck have to be made bigger because there's no room for stuff there. And people come with stuff and they accumulate it. And those are SROs, and there's not even room for a Charlie Brown Christmas tree. I mean, there just is no room, and you're condemning them to a small, hardly usable unit. I know it's safe, it's warm, it's dry, but it's not a lot more than that. So I'm just wondering whereabouts are you and rolling them out? Are they all going to be SRO little units? Or are you designating some different sizes?
Thank you for that question. So in our first phase, we're very much focused on singles. So the photos that I showed are for singles. So you would not house a family or a woman with children in those units.
No.
There are some other photos that you can't see. So there is actually storage in the units, in the hallway and adjacent to the bathroom area. So we can provide, there will be more information about the type of unit and how you use them. So they're about 350 square feet in size. Those are the ones that we've used to, and we had very good feedback from the residents who lived in them. In addition to the unit themselves, on the ground floor of those buildings, there's also a large communal space where people can meet with their friends. There's also a commercial kitchen and a laundry as well as outdoor space plus storage for bicycles. So the photos that I showed were really very much a snapshot. They don't show all of the amenities that are available in the building. But yes, these ones in the first phase are focused on singles. In future phases, we may well look to partner to see if we can provide other types of housing. But our focus in the first phase was very much on providing options for people who are living in shelters, who have chronic homelessness or are facing chronic homelessness, have significant physical, mental health issues that needs to be addressed, along with addictions challenges. So there may well be women who are have experienced violence who may well get housed into some of these new units, but it would be as a single woman at this time. And then future phases, we may have more flexibility to broaden that out to other types of units.
Okay, and I don't want you to forget about container housing as well, because that's certainly something that came from the West Coast as well. The use of containers, shipping containers, and having them redesigned as fairly large units as well. So please don't forget those. For Marianne, you were talking about wage and enhancements for frontline workers, but that you only mentioned shelter and drop-ins. Are our housing providers excluded from that?
Yes, so we provided a proactive wage enhancement for frontline shelter workers. And that is, and now there is going to be a provincial wage enhancement as well along the same lines. And we're waiting for further details on what that is. It was in recognition that in shelters and in drop-ins, you are working in closer quarters with people. Sometimes it's difficult to maintain physical distancing. It is a more challenging environment. We wanted to make sure that the hard work of those frontline workers was being recognized, but also that there was an incentive for people to continue coming to work, because we certainly heard that there were concerns that people would decide not to continue to come into work, and that it would also support agencies to hire additional staff, because we are asking agencies to stand up more sites and they need more staff. So it was a bit of an incentive, and also just to recognize the hard work of people directly on the front lines.
Sorry. Go ahead, Abigail.
I just wanted to add a couple of things that I forgot to mention was that while modular housing, our focus has been on singles, we do have other programs from Open Door and also the homes being developed on the Housing Now site, which do include a much larger amount of family housing. So we're not looking to only develop singles housing. So we have a much broader spectrum through some of our other programs. I forgot to mention those other programs, so thank you.
Thank you. Marion, I just want you to not forget, my frontline workers are dealing with congregate living people. We are not a shelter, we are not a drop-in, but I have people that are working the front desk. They're working directly with the tenants. And we are being by Toronto Public Health. We, like Stephen at NamiRes, had all of our tenants here at our church location were all tested, and 100% came back negative. But we also were told that masks, shields, gloves were necessary for all workers all the time. So I lost a couple of frontline workers because they have children that they didn't have daycare for. They also were very afraid of, they were anxious. And so they rightly so stayed and they were laid off. So when you're talking about wage enhancement and that, we've gone ahead and done it in anticipation of when everyone was talking about the wage enhancement, and then it comes down the road and we find out that we are not available because we are not supportive and we're not a shelter. So just for your own information.
Thank you, Frances.
Thank you. Any further questions or comments? Angus, I see you have a follow-up question. Go right ahead.
Yeah, I just want to go back to the point I made about nonprofit housing being owned and controlled by the Indigenous community. I mean, it's a stretch to begin with to have the land owned by the city and leased to an Indigenous housing provider for 50 years. It's, unbelievably not in the spirit of reconciliation to be in a situation where the city says, good news, we'll own the land, we'll own the modular housing, which, by the way, can be moved from any site to anywhere. We'll own it all, and lucky you, you can apply to operate it. You can take all of the liability, all of the difficulty that goes with it, with absolutely none of the capacity building benefits that flow out of it. I think this is the Aboriginal Advisory Committee. So it may be the case that in my life at work here, I could get my head wrapped around it. But in the context of reconciliation and in the context of the broader Aboriginal community, I don't think that this flies at all.
Thank you, Angus. I appreciate you bringing that to the forefront. I think that, and Marianne and Abigail, feel free to respond. But when I think about the work of the new Indigenous Affairs Office, when I think about reconciliation and some of the major transformative operations before us right now, I do think that we have some collective work to do to really think about reconciliation and what it means to provide ownership over land to Indigenous people. I can say from the perspective of Native Child and Family Services of Toronto, which does have a significant real estate holding in the City of Toronto, we have always recognized the transformative capacity and the spiritual significance of owning land for Indigenous organizations and the freedom and equity and capacity that comes with that. And so I think that our partners at the city have their heart in the right place, but I would ask you to please respond as best you can to let us know what future pathways forward we may have to work together to increase capacity to strengthen Indigenous organizations through ownership of property and land, because it is a critical issue and it is a cornerstone to reconciliation.
It's Abby here. Can I respond?
Please.
I just wanted to say that the importance of land ownership and control of Indigenous housing by Indigenous nonprofit housing providers is something that's very important to the future. It is this is a pilot at this point for the city, and a small 100-unit pilot in partnership with the federal government. I do think there's room to continue this conversation about how we might, through a number of different ways, support the growth of capacity of the nonprofit Indigenous housing sector, including, we also mentioned grants around capacity building, but specifically around land and building. So I am keen to continue that conversation. I don't have something to offer you today with regard to this pilot, but I hear very loudly from this community and from others in the nonprofit sector that really control and ownership of assets is key to the growth of that capacity. So it's something we've heard, and we hope to continue to work with you on a solution for that.
I appreciate that, Abigail. Thank you very much.
Can I ask one question of Abigail? Where are the modular? Have you picked a location for where that first wave of modular homes are going to be?
We anticipate announcing that and starting the consultation on that within the next couple of weeks. So we have not announced those locations yet, but stay tuned. That information is coming soon.
Councillor Layton, did I see you? Yes, please.
Yes, thank you very much, Mr. Chair. I just, to Angus's point, I think that it is critical that we figure out a way, because the city's intent on always maintaining ownership is kind of it's a policy that, which I agree with, that we shouldn't be turning over public assets to private agencies. And our Housing Now program to this, not that like this modular housing is I think a separate track, but even on the Housing Now program, and there is a report at council on this, the approach has been to keep the land in public hands because we don't want to see it turned over to the private sector. We don't want to see it disappear. We want to ensure that we're achieving what city and societal goals on land. That same notion doesn't transfer over well to when we're trying to work with Indigenous partners in the spirit of reconciliation. I completely agree with Angus. I think it doesn't transfer over well, and it's not demonstrating that we're keeping in within the spirit of our goals of reconciliation. But I wonder if there is a pathway to say, to do both, to say that the land is never going to be turned over to the private sector because a housing project fails or a not-for-profit it isn't able to continue operating for one reason or another, but that the ownership piece is actually transferred over. And there are ways of doing this, and we're doing this, in fact, with some organizations around land trusts, so that it gives the peace of mind to the city that someone's not going to be profiting off this, and it's not going to leave the portfolio of land that is delivering on public good, but that in fact gives the capacity, both is a symbol of reconciliation by the transfer of ownership, as well as allowing not-for-profits to build capacity, because that's part of the reason why we're trying to transfer properties to land trusts, because then they can leverage them to do other great things. So I wonder if, while this pilot project aside, I wonder if there's the ability of this, if it's the will of the advisory committee, to send that indication to staff, if we haven't already done it through our comments, but to council more formally by saying, you need to start looking at models that help us achieve reconciliation, and building capacity of Indigenous organizations is actually part of the city's commitment, statement of commitment to Aboriginal people. So we're checking 2 boxes of commitments we've made as part of the housing, the Housing Now program, which is looking at more permanent transfers of property and more permanent housing that may meet the needs of Indigenous groups that right now Indigenous groups would be competing against for-profit developers. The same reason why not-for-profits aren't faring terribly well in that in that process, because when you're up against a developer who doesn't really care about the soft costs, because they have people on staff to develop these proposals, it's unfair. And I argued that the first time that went through, that we should reserve this for not-for-profits like they've done in other jurisdictions. So I wonder if, and I don't have anything prepared for it, but if we try to take Angus's point and bring it to the discussion that council is going to have next week, or later, sorry, 2 days from now, on a bunch of additional sites that we're going to be putting out there, to ensure that we're achieving that set aside, but also that set aside is respectful of the other city goals of reconciliation and helping build capacity for Indigenous-led not-for-profits and organizations. That's from me.
Thank you, Councillor Layton. That's very much appreciated. Any further questions or comments? I'm looking at my Brady Bunch screens here to see if I can see any hands waving. Brian.
Good morning, everyone. This is Brian Winters of the Toronto Inuit Association. First, thank you for your presentation. And my question is around eviction supports. The infographic that you showed us has the heartbreakingly high number of precariously housed Indigenous Torontonians. And Premier Doug Ford has recently spoken publicly about the disgusting conduct of landlords harassing tenants in this province during COVID. I understand that the LTB is suspending the issuance of eviction orders and all hearings related to eviction applications. However, people are still actively being harassed, including community members who've brought this to my attention repeatedly recently. So I'm just wondering what additional actions the City of Toronto is willing to take to protect these precariously housed Indigenous Torontonians from harassment.
Hi, it's Abby here. So we have been, both through the stakeholder group under the leadership of Deputy Mayor Bailau, but also through staff working with our Renters Advisory Group, been hearing from people about some of the issues faced by renters in the city. It is a difficult situation that the city is in. We're not responsible for the legislation which governs that relationship between landlord and tenant. So at this point, one of the things we're doing is collecting information. So predominantly we're trying to find out how often this is happening, the situation that it's happening in, and kind of navigating or trying to assist people to navigate and highlighting this issue to the provincial government in terms of how much it's affecting people. So we're not, at this point, we don't have the resources or the direction from council to step into that gap, if you like, to provide direct services. But certainly we're looking to support people when we can through community agencies. And importantly, I think just share that information about what is happening on the ground with provincial colleagues.
And I just wonder if I could, it's Marianne, just add one part. We will be announcing later this week some financial support to support tenants who are having difficulty paying their rent. So that announcement will be coming out later this week.
Thank you.
You both. And Abby, I guess I should start making a list of the people who are complaining at this point then and save it for you guys.
Can I ask, Marianne, the rental assistance that you're planning on announcing, is that forgivable for the tenants, or do they have to, which is going to be extremely difficult if these things go for, you know, the way they're looking at it, for another year before the things clear up? Are these forgivable rents?
It's not forgivable rent. It will be a access to funding to help you pay your rent. Although it is recoverable, it is recoverable on a schedule that is determined by the client. So, you know, it's not a set amount you must pay back every 2 weeks, or the full loan must be paid back within this period of time. So it is absolutely something that we work on with the person receiving the money to figure out a repayment plan that works for them. So, you know, if they are out of work at the moment and not receiving any benefits, does that mean that they can't start paying back for a number of months, and then when they do, this is the amount? Those are options that are available in that discussion. But more details will be released this week, Francis. But we're definitely aware of the difficulties that people are having right now, and it is our intent to keep people in their housing as opposed to having them lose their housing and end up needing the shelter system for that level of support. So definitely interested in stabilizing people in their current housing.
Thank you.
Any final comments before we move on?
Just further to Councillor Layton's proposal. I don't know, I don't want to call it proposal, suggestion, his advice, his thoughts. Do we put that in a motion now? Can we do that? Or you going to respond? Go to it.
So when our questions are complete, we are going to be moving on to the question of whether or not there's any speakers to the item, which is the time when we can indeed make motions, Francis, if you are proposing one.
Michael, you wanted to say something?
I can speak to the item. I have sent you an email. I sent an email to the clerk of some very simple language that I think might be helpful, given that this is in the context of the discussion, we were talking about this pilot project, which the intent is to move it quite quickly. But at council, there is a much more robust report from Housing Now that doesn't have sites yet linked to it. And I'm hoping Abigail has great news for me, because I have a site that's really close. But that tries to capture the suggestion of that Angus made. And I'm trying to find Angus's email so I can flip it to him real quick so he can take a look and make sure that it does capture it. But I can introduce it in any second when we move on from questions.
The clerks will have it up in a moment, Councillor Layton. Just bear with us one moment, folks, and we're going to get that up on the screen. We have a couple of motions to consider as a committee. We're going to give the clerks, oh, you're ready? Okay, we're good. All right, let's do this. I'll just read this out, folks. So, that the Aboriginal Affairs Advisory Committee recommends that City Council consider as part of the Housing Now initiative dedicated sites for Indigenous housing projects and the ownership of land reflect the city's commitment to reconciliation and the commitment to support building capacity amongst Indigenous organizations. We have this motion on the floor for commentary. Francis, how do you feel?
I'm all in favor of that. I'd second that in a heartbeat.
If I could just in a second, I'm suggest two things. One, I think it captures the intent of what Angus was saying, and correct me if I'm wrong. The reason I just wrote this, so there could be 101 things wrong with it. I can appreciate that. The reason why I use the language about consider the ownership, it's just for us to kind of get around this notion that there may be 100-year leases, there may be the notion of right of first refusal for the city to purchase it back at some point in the future, just to address the issue and the criticism that we've had from some around just kind of selling the sites to the highest bidder. So I don't know what it looks like yet, but I didn't know what other language I could use to get across the point of the ownership. So I took my best first shot. I'm very much open to any friendly amendments, or if anyone wants to take this and recraft it. I can appreciate if writing, normally what we would do is kind of take a pause and put a couple heads together, which makes it very difficult in this forum. But there is a report at council just in the coming days, so I would hate to lose that point.
Angus, did I see your hand raised?
You did, yes, yeah. I'm fine with that. I think it's good. I personally, I can get my head wrapped around the idea of long-term leases. We have a building that was developed at 20 Sewells Road, which is owned or leased from. It's built on property that's leased from the City of Toronto for 50 years. I'm okay with that. I think it's better if you can own the land, but I don't think it's absolutely necessary. But I think when you start to combine the city owning the land and the city owning the units and the units being movable, that at that point it becomes questionable. So it's not just for me the piece about the land, but it's the ownership of the land and the buildings.
Thank you, Angus. Steve, I believe I also saw your hand raised. Would you like to make a comment?
Yes, you did. I love the idea of the land ownership. I know recently NAMI Res 2, we opened up a housing project last June where it's a 50-year lease from the city, and we fixed that house up really nice. It's a beautiful piece of property. It would be nice if we could own it, and I was wondering maybe if the motion that Mike was suggesting, if it could look at maybe projects in retrospect as well, perhaps Sewell's Road as well as our project also. Because, we are looking at other affordable housing projects, but it's really difficult sometimes to get the capital to access those. But if you can leverage the property that you currently own to help create opportunities for future new projects, that would be extremely helpful. And that's not an option with our housing right now in the downtown core. So that would be very helpful.
Thank you, Steve. So, Councillor Layton, do we need to make some tweaks, or do you feel like this is good to go?
I could try to make a very quick, if anyone else wants to speak to the item, I could make a quick I mixed up Teakins and quick there. a quick tweak to capture what Mr. Teakins just said. If I would just need a brief minute.
Sure. Yes. No, that would be great. Should we move on? Okay. Yes. Let's just take a minute. So I actually have a motion that I would like to put on the floor for consideration, and so I'm, with the help of the city clerks, we're going to put that up now for discussion to allow Councillor Layton some time to revise the motion we were just discussing. I'm just going to read this out to the group. That the Aboriginal Affairs Advisory Committee recommends that City Council request the Chief Recovery and Rebuild Officer, in consultation with the Director, Indigenous Affairs Office, and other appropriate city staff, to take into consideration the Aboriginal Affairs Advisory Committee's concerns and suggestions on mitigating the impacts of COVID-19 on the Indigenous community in preparation for the recovery and rebuild strategies, including naming a reconciliation and COVID-19 recovery lead, and gathering feedback from the committee once staff have conducted community engagement and consultation. We have this motion on the floor for comments and feedback from the committee. Just one moment, we'll take this down so that I can see all of you, to see if any of you have questions or comments on that. Perfect. Would anyone like to speak to that issue? Francis, I think I saw your hand.
Yeah, what kind of consultation are you talking about in the motion, Jeffrey?
At the end, I said gathering feedback from the committee once staff have conducted community engagement and consultation. So the Recovery and Rebuild Office is planning on doing some consultations themselves. What I'm suggesting is once that office has coordinated with folks and done those consultations, that they bring that back to the committee so we have an opportunity to learn about how those consultations were done, how they took place, what information was gleaned, and then to provide comments and feedback as a committee to that process and what was generated through it.
What I'd like to see is I'd like to see some Indigenous people on the committee.
Which committee, Francis? The committee that's doing...
On the committee that's going to be doing the research and consultation. Within our community, I'd like to see some members of that committee also be Aboriginal.
Of course. So you're
Indigenous, sorry.
Right. No. So you're suggesting that the Chief Recovery and Rebuild, so that the Recovery and Rebuild Office include Indigenous folks in their consultation with the community. Is that what you're saying?
No, the committee. I want them to. Is it possible to have on their committee that's going to do the Indigenous communities, have some of those researchers and consultants be Aboriginal?
I see. So sorry, the committee I'm referring to is actually the Aboriginal Affairs Committee. So I'm suggesting that once the Recovery and Rebuild Office is going to go and do their community engagement, they'll do that with all Torontonians around their areas of focus and interest. I'm suggesting that they bring the work that they've done with Indigenous folk back to the Aboriginal Affairs Committee, and that we as a committee be the ones that have the opportunity to learn about their process and provide feedback to it.
Absolutely, I expect that. I don't even think that needs. I don't think that needs a motion. That's expected to happen. Number one, but the committee that is going out and doing all this research and finding out all these answers, and when they come to doing the research within the Aboriginal community, I want some of those people, those researchers, to be Indigenous. They haven't. I asked them about whether they have the competency. Well, I can't say it. Aboriginal awareness training ahead of time, and he's having to check back with with Selena to find out whether they don't even know whether these people are trained and had the proper education and know the background of our community. And then now they're going to go out and start working in our community. I want them to be people who have an understanding of who we are, that I can feel confident giving information to, that it's going to be regurgitated back properly. That's what I'm saying.
And I couldn't agree more. So I'm wondering, we've just thrown the motion back up so that we can see it. I'm wondering if we're talking about adding another point here about perhaps naming a reconciliation and COVID-19 recovery lead, ensuring that the Recovery and Rebuild Office utilizes Indigenous people in their engagements with the Indigenous community, and then that they gather their feedback from the process and bring it back to the Aboriginal Affairs Committee. Does that make sense, Francis?
I can jump on that one easy. Good.
Okay. So we're just adding another bullet underneath there around a request for the office itself to utilize Indigenous people in their consultation with the community. Any further questions or comments about this motion?
I would like to add one more thing to, I guess, the mix in terms of, so we have the lead, hopefully that's an Indigenous person. And then when you're looking at the layers to which, research and consultation is done in an Indigenous community, sometimes what you see is there might be a non-Indigenous person leading it, and then Indigenous people are working with them. And I would like to see that you have Indigenous people who have the experience and skills that were discussed. They're leading it. It's not they're working under somebody, they're leading it. That's what I would like to see happen.
Thank you. We're just doing some, the clerks are busy working on some amendments. Ruth, I see your hand raised.
Yes, thank you. I thank you for putting up the motion and for hearing this. I totally agree with what has been said before. We have, a large number of Indigenous academics who do depths of research. We have people at the U of T in the Dalai Lama Public Health. We have, health researchers across the city. Tap into this knowledge. This, we don't want to just have a report back, or as Regina had said, had the Indigenous person be in response to the researcher. Instead, let's have the Indigenous people be the researchers. As long as it's clearly articulated that, as Francis and Regina have, so I just think we have the resources. There are Indigenous researchers who could do this work, and so I want to really push hard that it doesn't come back that we couldn't find anybody. Because
Thank you, Ruth. Agreed. I think what we're going to be asking for is that a reconciliation lead be named, and that as much as possible, the office work with Indigenous folk while conducting consultations and research. And the wording of that is just being updated as we speak. And while in process, I'll just ask if anyone else has further comments to share in regards to this motion. Tanya.
Go ahead.
Tanya.
I just wanted to say that I'm in complete agreement with that decision, that the research be Indigenous led. And as Ruth said, there are multiple scholars and researchers that do this type of work, whether it be through the University of Toronto Walkman and Bryce Institute or in other places and spaces. Thank you.
Thank you for that, Tanya.
I would even add to it and see if it's possible that the research be led by an entirely Indigenous team, so that you have that representation across the board. So I just put that out there, that if we can do this, that it's an entirely Indigenous team.
Thank you. Should see how fast the fingers are moving of the diligent clerks over here in this committee room. Just bear with us one moment, please. We'll have a revised motion up momentarily, folks. Okay, here we have it. I won't read through the body of the motion because that hasn't changed. What we did amend was subpoint A, naming a reconciliation in COVID-19 recovery lead, ensuring that the Toronto Office of Recovery and Rebuild utilize Indigenous peoples in the research and consultation process. And then B, that they would gather the feedback from the Aboriginal Affairs Committee once they've conducted community engagement and consultation. Is that satisfactory to the committee? And I can't see you because the motion is on, so you can feel free to unmute yourself and let us know if you have thoughts.
Can we offer some wordsmithing?
Sure, Ruth. What are you thinking?
I don't like the utilize. I don't think that we should be utilized. I think we need to be utilization of Indigenous peoples feels really problematic in my engage, hire.
Ruth, why not appoint lead?
Yes.
This is when we truly get to discover how challenging virtual committee meetings are, right, folks? But we're going to get through this. So I understand what you're saying, Ruth. We don't want to be utilizing. Do we want to be other suggestions?
Appointing.
Appointing?
Appointing, yes.
Appointing Indigenous people for the research and engagement process? Research and consultation process?
I'm more comfortable with that.
And recognizing our leadership within the research process.
Understood. Okay. So really at the heart of this, and we do want to be as concise as possible to support our partners here at the city, I'm thinking that the important part for us is that this is Indigenous-led and that Indigenous folk are involved in this work, and that the new office is appointing Indigenous people to take on and lead this process. We're going to do our best to reflect that in the wording. Give us a second. Fifteen seconds, folks. We're almost there.
Thank goodness it's not back in the days of the typewriter and the carbon paper.
Okay, folks, let's look at this one more time and hopefully put this to rest. Naming a reconciliation in COVID-19 recovery lead, ensuring that the Toronto Office of Recovery and Rebuild appoint Indigenous peoples and recognize their leadership in the research and consultation process. we'll fix the tents there, but does that get at, how do you feel about that, Ruth? Appoint Indigenous people and recognize.
That works.
That works? Good. Fantastic. Okay. Okay. Okay, so everyone satisfied with this incarnation of the motion? I see some nodding heads. Okay, good. Let's revisit Councillor Layton's motion then, just so that we can get that one firmed up as well. We'll get that on the screen. Here we are. In light of the COVID-19 emergency, that City Council consider as part of the Housing Now initiative, dedicated sites for Indigenous housing projects and the ownership of land reflect the city's commitment to reconciliation and the commitment to support building capacity amongst Indigenous organizations and examine existing leases where land or building ownership might be able to be transferred to Indigenous operations. I like that. Okay. Thoughts and feedback from the committee? And I cannot see you at the moment, so feel free to unmute yourself and go for it.
Could we change operations to ownership? The last word of the motion.
Operations to organizations, or Councillor Layton, did you have a comment to that?
Ownership might not work, but I don't know why I wrote operations. My apologies. But organizations would, I think, be the appropriate.
Okay, organizations.
I think that's what I was trying to type. It's just because if they're not-for-profits aren't owned per se in a traditional sense. So I think it's probably organizations.
That's fine. That's fine.
The troubling thing is then you get into a debate about what organ. I think everyone gets the point. So if you change it to organizations, that would be more correct, more in keeping with what I had written.
I think that makes sense, Councillor, to have organizations as the last word. Angus, does that work for you?
I did write operation. That was my fault.
One question that I have on it, dedicated or dedicate? Are you going to use dedicated land that's already been dedicated, or are you going to dedicate land?
That's a good question, Francis.
So the intent of that was to do a set aside, essentially. Like, we have sites coming forward, but if we hit Indigenous existing not-for-profit operators up against some of the larger for-profit companies that are applying for some of these sites, it just might be no contest. You might not have a shot. Whereas if we start ensuring that some of the sites are dedicated to Indigenous projects, I would also love to see them all dedicated to not-for-profit organizations. But I might lose that vote at council. So that's more about the set aside, not picking the sites. I think that might answer your question. I'm not sure.
Dedicate to me is more positive that they dedicate sites as opposed to using sites that are already dedicated?
It creates a little more flexibility. I'm supportive of that change. To dedicate sites.
Okay.
We're making the change. Just give us.
I think the office, our housing secretariat is getting the general point of it. So I think one or the, I'm comfortable with either.
Agreed. Thank you, Councillor.
So we don't have to hit them with a bat then.
No, I think we're good. I think we're getting a little bit into the weeds on wordsmithing. I think we've captured the intent of these two motions. We're going to get them up for final review in just a moment. Okay, folks, here we go. In light of the COVID-19 emergency, that City Council consider as part of the Housing Now initiative, dedicating sites for Indigenous housing projects and the ownership of land reflect the city's commitments to reconciliation and the commitment to support building capacity amongst Indigenous organizations and examine existing leases where land or building ownership might be able to be transferred to Indigenous organizations. Very nice. Okay. We'll get back to the grid view if you don't mind, and then we'll just take a look. Are folks supportive of that? Perfect. Steve, that was a raising your hand in support, not raising your hand in a question, right? Perfect. Okay, good. Thank you. Okay, folks, so we're ready to vote on these motions. As explained earlier, we are going to take an acceptance of a vote yes is simply raising your hand in the window. This is being broadcast live, and it's important for our meetings to be public, so this is an important part of the process, holding this meeting virtually. So I'd just like to ask everyone who is in favor of the motion on the floor by Councillor Layton to please raise your hand if you are in support of the motion. If you do have your video off, I do need you to turn it on. Andrea, if you're there, we cannot count you as a vote in favor. If your video was not on, mine is not on either, but I don't think I get a vote, so that's fine. Okay, so we do have unanimous support for this motion, with the exception of Andrea. Thank you. We're now going to vote on the second motion that I put on the floor for the Recovery and Rebuild Office that we wordsmithed. I'd just like to ask if people are in favor of that motion. Hands up if you are in favor of that motion.
Do we have seconds at all? Do we have seconds for these?
No, we're not doing it. We're not doing seconds in this context. We're just doing voting by our hands in the WebEx box. Okay. Everyone in? Okay. It looks like we have support for that second motion as well. Steve Teakin's throwing in a thumbs up. Thank you, folks. Thank you, everyone. I appreciate everyone's, resilience and adaptation as we move through this new way of holding meetings in the context of these unprecedented times. Members, I would like to move a motion to excuse the absence of committee members who are not in attendance for the meeting today. Could I please get clerk staff to display that motion? This motion reads that the Aboriginal Affairs Advisory Committee excuse the absence of Shadrach Gobert, Nancy Martin, and Blanche Miyawasi from the May 26, 2020 Aboriginal Affairs Advisory Committee special meeting. Thank you. You can take that down at your convenience. Go back to grid view. I'd like to ask that everyone in favor of this motion please raise your hand so we can get that captured on the video. Gina, did you get your hand up? Beautiful, thank you, thank you. Steve again with the thumb, okay. Fantastic. Thank you, everyone. We have approval for our 3 motions. Okay, thank you. Thank you, everyone. I understand that we are now going to have a closing. We're bringing our meeting, we've addressed our items, approved our motions. We are coming to a close. I'd like to ask Francis if you could please lead us in a closing prayer for this meeting today.
We ask that you grant the grandmothers and the grandfathers of the 4 directions to watch over us as we travel on our way, to watch over those under our umbrellas of support and service, watch over our families and those who are dear to us. Creator, we ask that you keep all of our minds open, all of our hearts open, all of our ears open, so that we can see the beauty that's all around us, that we can hear the voices that come to us, and that we can speak with kindness, understanding, and respect. Creator, we ask that you watch over each and every one of us again and keep us all well and out of harm's way until the next time that we should meet. For all these things, Creator, we say miigwech, miigwech, chimigwech.
Thank you so much, Francis, for ending us in a good way. I'd just like to say thank you to all of our members and staff. That does conclude our business today. The special meeting is now adjourned. I'd just like to wish you all health and wellness throughout COVID, and we'll look forward to seeing you next time. Thank you very much.
Merci. Thank you.
Bye, all. Have a good one. Put on your sunscreen.
Bye, Selena. Bye, Francis.
Take good care, everyone.